I wanted to dip into what I think about as the greatest hits archives again and talk a little bit about whether HRV is a biomarker for anxiety. I realize I jumped in previous videos straight into the idea of treating anxiety with HRV biofeedback, but didn't establish the more fundamental point of, is HRV different in people with anxiety than in people without anxiety? Or alternately said, is HRV a biomarker for anxiety? You've probably recognized at this point that I love meta-analyses, and I do. And the reason I love meta-analyses is by pooling together data and subjects from multiple smaller studies, you get a much larger sample size and you smooth out any biases that may be associated with any individual study. And it turns out there's a really nice 2014 meta-analysis looking at the question of whether HRV is different or reduced in people with anxiety compared to people without anxiety. So in this 2014 meta-analysis, they pulled together 36 smaller studies for a total of over 2,000 people with anxiety and 2,300 people without anxiety. When they looked at the data, they did indeed find that people with anxiety had reduced HRV compared with people without anxiety. They also looked at subcategories by anxiety diagnosis and found reduced HRV in people with generalized anxiety disorder, post-traumatic stress disorder, panic disorder, and social phobia. They did not find a difference in HRV for people with obsessive compulsive disorder. Interestingly, and subsequent to this study, people have really begun to think of OCD as something different than an anxiety disorder, and is no longer really grouped together with anxiety disorders. So why does this matter? In some ways it does, and in some ways it doesn't. Ultimately, what really matters is whether the intervention, in this case HRV biofeedback, is helpful. And we know it is from previous studies I've talked about. However, it's also interesting to know if the thing you're looking at, in this case HRV, is altered in the condition you're talking about, such as anxiety. And in this case, it's helpful to know that HRV is different in people with anxiety, and that somehow something about HRV, presumably related to the sympathetic-parasympathetic balance, is actually directly connected to the condition of anxiety. And therefore, we're actually not just accidentally treating something, but treating something that's fundamental to anxiety itself. In the case of LEAF, this especially matters because one of the unique things about LEAF is it's able to detect low HRV in real time and therefore prompt you to do a breathing exercise to restore your parasympathetic-sympathetic balance and help treat and alleviate and catch in real time the processes that feed into anxiety.